Silent heart attack, causes and treatment. A silent heart attack is a heart attack that occurs without symptoms or with unrecognized symptoms. A person may not know they have had a heart attack until they receive a diagnosis weeks or months later. This video discusses the signs of a silent heart attack. It also outlines risk factors, recovery, and treatment for people who have had a silent heart attack. Can you have a heart attack and not know it? A silent heart attack is a lack of blood flow to the heart, often resulting from blocked arteries, that occurs without pain. Because there is no pain, a person may not know they have had a heart attack and may not seek medical attention. An individual may dismiss any symptoms that occur as simple fatigue, a strained muscle, or indigestion. They may only learn they have had a heart attack if they undergo testing for other symptoms. According to the American Heart Association, silent heart attacks account for around 1,70,000 of the estimated 8,05,000 annual heart attacks. Dangers of a silent heart attack. A 2018 study found that people who have had a silent heart attack have the same long-term survival as those who have had ordinary heart attacks. The authors found that about half of all survivors of a silent heart attack died within 10 years of the incident, which is the same rate as for survivors of other heart attacks. However, people who have had a silent heart attack may be at risk of other complications such as heart failure and stroke. According to another 2018 study, a person who has had a silent heart attack has an estimated 35% higher risk of heart failure than a person without a history of heart attacks. People in their early 50s or younger have an even greater risk increase. Moreover, a 2021 study suggests that people who have experienced a silent heart attack may have an increased risk of stroke later in life. Who is at risk of a silent heart attack? According to the American Heart Association, silent or unrecognized heart attacks may occur more often in females than in males. Risk factors for a silent heart attack, which are the same as for a recognized heart attack, include high cholesterol, hypertension, obesity, smoking, age, a family history of heart disease. Signs and symptoms. Some people may not experience any symptoms or signs of a silent heart attack, while others may experience non-specific symptoms that they do not connect to a heart attack. This can include excessive prolonged fatigue, indigestion, a feeling of a strained muscle in the back or chest, shortness of breath, dizziness, malaise, trouble sleeping, sweating, nausea. Causes. A lack of oxygen-rich blood to all or part of the heart leads to a heart attack. Most heart attacks are due to atherosclerotic heart disease. This condition develops when plaque builds up in the coronary arteries. In some cases, a portion of plaque can break free and form a blood clot. If the clot grows, it can cause a blockage that prevents blood from reaching the heart. Although this is less common, a severe spasm or tightening of a coronary artery can also lead to a heart attack. The spasm stops blood from reaching the heart. Health experts do not know the exact cause, but several factors may play a role, including exposure to extreme cold, stress or pain, smoking, use of certain drugs. Treatment. When a person presents with heart attack symptoms, an emergency room doctor will begin medical therapy immediately and call a cardiologist to assess whether the person needs emergency stent placement. Immediate medical therapies include aspirin, which prevents clotting, other anticoagulants such as heparin, nitroglycerin, which improves blood flow and reduces the burden on the heart, beta blockers, oxygen therapy. If doctors diagnose a previous silent heart attack, they may recommend that a person take medications such as the following to help lower the risk of a future heart attack: aspirin, statins, beta blockers, blood pressure lowering medications such as ACE inhibitors or angiotensin receptor blockers. How long can a silent heart attack last? The duration of a silent heart attack can vary. If a person experiences symptoms, they should seek medical attention immediately. When blood flow to the heart stops for around 20 minutes, the heart can sustain irreversible damage. However, this time frame can vary. When to seek emergency medical attention. An individual who suspects they have symptoms of a heart attack should seek emergency medical attention immediately. They should call for emergency services and get an ambulance to take them to the hospital. After effects and recovery. A person may not know for several years that they have had a silent heart attack. They may only discover if when they visit a doctor for a routine exam or other health issues. Some people may experience decreased exercise tolerance, fatigue, or an increased heart rate after a heart attack. It is advisable for a person to seek guidance from a doctor about steps to take after a silent heart attack.